Carl Sagan said, "You have to know the past to understand the present." According to Dariush, although food and nutrition have been studied for centuries, modern nutritional science is surprisingly young. Casimir Funk 1914 produced the idea of a vitalamine in food. The first vitamin, thiamine, was isolated and chemically defined in 1926, later synthesized as vitamin B1. This vitalamine, or vitamin, was first isolated in 1926, named thiamine, and subsequently synthesized in 1936 as vitamin B1. In 1932, vitamin C was isolated and definitively documented, for the first time, to protect against scurvy. By the mid-20th century, all significant vitamins had been isolated and synthesized. Their identification in animal and human studies proved the nutritional basis of severe deficiency diseases. Initially, they led to dietary strategies to tackle beriberi, vitamin B1, pellagra, vitamin B3, scurvy, vitamin C, pernicious anemia, vitamin B12, rickets, vitamin D, and other deficiency conditions. However, the chemical synthesis of vitamins quickly led to food-based strategies being supplanted by treatment with individual vitamin supplements. This presaged modern-day use and marketing of individual and bundled multivitamins to guard against deficiency, launching an entire vitamin supplement industry. From the 1950s to 1970s, researchers focused on fat versus sugar and the protein gap. And in the late 1970s to 1990s, diet-related chronic diseases and supplementation became the focus. In the post-1990 era, clinical trials were about nutrition, genetics, isolated vitamin supplements effects, specific diet patterns affecting diseases, etc. The father of modern medicine, Hippocrates, coined the famous saying, "All disease begins in the gut." Research has proved a relationship between functional components of food and health and well-being. Thus, functional components of food can be effectively applied in treating and preventing diseases. Food's functional components act simultaneously at different or identical target sites to impart physiological benefits and promote well-being, including reducing the risk of cancer, cardiovascular disease, osteoporosis, inflammation, type 2 diabetes, and other chronic degenerative diseases, lowering blood cholesterol, neutralizing reactive oxygen species and charged radicals, having an anti-carcinogenic effect, and promoting a low glycemic response. In 1828, in one of his books, Anthelme Brillat-Savarin, a French politician and influential commentator on food, said, "You are what you eat." The food you eat can be either the safest and most potent form of medicine or the slowest form of poison. And Wigmore, from these quotes, we learn, "Tell me what you eat, and I shall tell you who you are." The relationship between our dietary choices is complex. It affects the health of our gut microbiome and profoundly impacts our mental and emotional well-being. Conlon and Bird, in The Impact of Diet and Lifestyle on Gut Microbiota and Human Health, wrote, "Diet, particularly macronutrients, has a crucial role in shaping the composition and activity of these complex populations. Short and long-term dietary changes can influence microbial profiles, and infant nutrition may have lifelong consequences through microbial modulation of the immune system." According to Flynn, in The Impact of Nutrition on the Human Microbiome, further posited, diet-derived carbohydrates that are not fully digested in the upper gut, known as non-digestible carbohydrates, provide a major source of energy for bacteria that colonize the human large intestine. It is well established that dietary intake of non-digestible carbohydrates influences microbial fermentation and total bacterial numbers in the colon. To be healthy, we must be aware of the adverse effects of modern, processed diets on gut health and practice and promote a healthy microbiome through dietary diversity and the inclusion of probiotic and prebiotic foods. Even the most balanced diets may have nutritional gaps due to modern agricultural practices and lifestyle factors. Chan, Michalak, and Agelona. In Importance of Nutrients and Nutrient Metabolism on Human Health, found that the human diet is comprised of diverse components which include both nutrients, supplying the raw materials that drive multiple metabolic processes in every cell of the body, and non-nutrients. Industrial agriculture practices, over-farming, and synthetic fertilizers are the leading causes of soil depletion of essential nutrients. Coupled with the industrially manufactured processed foods we consume are the leading causes of nutrient deficiencies and gaps. To fill the gaps, we need vitamins and supplements. According to the National Institute of Health, Office of Dietary Supplements, know that dietary supplements are intended to supplement our deficient diets and not prevent chronic diseases. Discuss any dietary supplements you are taking or plan to take with your healthcare provider. It is essential to choose only the high-quality products that meet the safety and efficacy standards and manufacturing guidelines set by the Food and Drug Administration, FDA, and have passed the quality tests by at least one of the following organizations: Consumer Lab, NSF International, or U.S. Pharmacopoeia. Consult your health care provider before taking dietary supplements to treat a health condition. Get your health care provider's approval before taking dietary supplements in place of or in combination with prescribed medicines. If you are scheduled to have any surgical procedure, talk with your health care provider about any supplements you take. Keep in mind that the term natural does not always mean safe. Some all-natural botanical products, such as comfrey and kava, can harm the liver. A dietary supplement's safety depends on many things, such as its chemical makeup, how it works in the body, how it is prepared, and the amount you take. Before taking any dietary supplement, use the information sources listed in this fact sheet and talk to your health care providers to answer these questions. What are its potential benefits for me? Does it have any safety risks? What is the proper dose to take? How, when, and for how long should I take it? Herbs and spices are flavor enhancers and potent natural healers with anti-inflammatory, antioxidant, and antimicrobial properties. Here are a few examples of herbs and spices that have been studied and documented for their positive effects on human health. Turmeric, curcumin. Curcumin, the active compound in turmeric, has potent anti-inflammatory and antioxidant properties. It may help reduce inflammation, support joint health, and potentially prevent chronic diseases like cancer and Alzheimer's disease. Cinnamon. Health benefits. Cinnamon contains antioxidants and has been linked to improved insulin sensitivity, reduced blood sugar levels, and potential protection against heart diseases. Garlic. Garlic has antimicrobial properties and may help lower blood pressure, reduce cholesterol levels, and support immune function. Ginger. Ginger has anti-nausea properties and may help with digestion, reduce muscle pain, and alleviate symptoms of osteoarthritis. Oregano. Oregano is rich in antioxidants and has antimicrobial properties. It may help fight infections and support overall health.